Hi, Chris here with AffinityHM.com, and today I'm going to tell you about the 3 most common problems using CPAP for sleep apnea. So perhaps you were recently diagnosed with sleep apnea by your physician. Maybe you've already had your sleep study. Maybe you already have received your CPAP machine and you're just kind of getting started with it and out here searching for some answers on how to make this whole experience better. That's what I'm here for. I want to share with you some knowledge and experiences that I've had. I've set up CPAPs for people for decades. I'm not going to tell you exactly how long. It's been a long time. I've set up a whole lot, thousands of CPAPs. And so I feel like I'm at a unique place that I can hopefully help people out here in the YouTube world kind of get through the experience. What motivates me to try to help you right now is having seen so many people have struggles, especially in the beginning using CPAP, and to overcome those struggles and then see them later having life-changing situations where CPAP really makes a huge difference. I can't tell you how many times I have set up someone on CPAP, talked to them maybe a week later, and they're just ready to give up. And you know, they just want to throw that CPAP out the window. You may be able to relate, and never ever see it again. And then talk to them 6 months later, and they literally will not ever stop using CPAP because they love it. And if you can just get past the difficulties in the beginning, then you will find that the benefits that you receive from using the CPAP and getting truly good sleep by far outweigh the difficulties and the roadblocks that come along the way. I will tell you, almost everyone has some problem using CPAP. It's really rare that we set up CPAP and it's just like, hey, A-okay, I've got it all the way, no problem. That does happen. That might be you. But the majority of everyone who begins using CPAP does have to kind of get over some hurdles in order to get used to using it. So I'm going to tell you what my experience has been for people in general, the top 3 difficulties that they would have using CPAP. We're going to start at the number 3 and move our way up to the number 1, the most important. Starting with number 3, it's going to be the mask. You've got this deal on your face whenever you're going to sleep, plus there's pressure coming in. So it's important that the mask fits correctly. So when you're at your provider, just make sure that they are actually using a sizing gauge and sizing out your nose and making sure that the mask that is selected is the proper size for you. Of course, the sizing gauge is just a little card that would be used to measure between right here in between your eyes and right here underneath your nose. The distance is different on different people, and that will determine what size of mask that you might need to use. That's if you're using a mask that is only over your nose. Now, if you're going to be using a mask over your nose and your mouth, then they're going to be measuring from here, right between the eyes, and right here underneath your bottom lip where the skin kind of dips in. And that size right there would be for a full face mask. Now, whether you use just a nasal mask only over your nose or a full face mask over your nose and mouth is really determined by how well you did in the sleep study. Were you a mouth breather? Were you breathing through your mouth and your nose? Were you breathing just through your nose? Do you have a deviated septum? There's just a lot of factors involved, and so the professionals who are setting up your CPAP should guide you through that decision. Ultimately, it's probably going to be your decision and your doctor's, but do make sure that the mask is the proper size. Now, if you're able to use a mask just over your nose, I would recommend possibly the N20. This is the one, I've got a little mannequin here, my buddy. He's got an N20 mask on, and you can see that it's over just his nose and it's fitted properly for this mannequin head. It's got a little headgear around the back. The cool thing about the N20 is that it has a little magnet that attaches here. So whenever you're ready to, if you need to go to the restroom in the middle of the night or something, it's super easy to take off and put back on. If you're like me, in the middle of the night, you're not really wanting to search for little clips and buttons and pins and such. So the magnet's really nice to make it easy on, easy off. And the mask is reasonably comfortable. I want to get back to that a little bit. There is no mask that is 100% comfortable. You know, they do now, in the last few years, they've started making them a lot more comfortable than they used to be, but it's going to just take some getting used to. Another choice that I like to help people with is this one is the Swift FX. Now, it's been around for a long time. So it's got a nice little strap around the back, a little plastic strap that is adjustable on the top of the head. And then the cool thing is that it's really not touching your face hardly anywhere except right here, where it's going to go right into the nair. It doesn't really go far into the nose at all. It seals around the outside edge of the nose, and that is really the cool thing about this one, is that, you know, if you feel a little claustrophobic or something like that, it's so much less on your face, so it's a lot easier to use than any of the other ones. So if you can get away with using the Swift FX, that would be a good choice, in my opinion. Then there's the full face mask that would go over your nose and mouth, and those are fine too, but personally, whenever I'm setting it up, I only go to that full face mask as a last resort. If, you know, trying these masks, maybe even with a chin strap to help keep the mouth closed. If none of that's working, then we'd like to go to the full face mask if needed, but it's not always needed. So the mask fit is really crucial. So if you're putting your CPAP mask on, you know, and starting your CPAP machine, and nothing's leaking, and you're laying down and going to sleep, and then all of a sudden you start experiencing a lot of leaks, then it may be that the mask just needs to be tightened up a little more, or maybe you've got the wrong size mask. So it is really, really important to make sure that that mask is correct. The number two thing that I hear a lot is the pressure. Now, it could be that you are complaining about there is too much pressure coming in, and I'm having difficulty exhaling. So if you're having difficulty exhaling, that is actually to be expected. Because if you think about what's going on with the sleep apnea, obstructive sleep apnea simply means that whenever you fall asleep, your airway relaxes to the point you go into that deepest stage of sleep, that your airway completely relaxes. Everyone's airway completely relaxes. But people who have sleep apnea, when that airway relaxes, it actually closes off, and the air is no longer able to move in and out through the airway. So it's important that we have something happen that will keep your airway open so that you can go into that deepest stage of sleep and actually stay there. So the pressure that's coming in is really what you need. It is actually the therapy that will maintain your airway open so that whenever you breathe in and you breathe out, the airway stays open. So while you're awake, it may seem like a lot of pressure and something that you can't tolerate, but whenever you're asleep, it is exactly what you need. So there are some mechanisms in most CPAP machines today that make it easier to exhale. It may be called Easy X. There's all kind of different names for it, but it's a setting on the CPAP machine that will make it marginally lower pressure at the time when you're exhaling to make it a little more comfortable. Or if it's possible that the machine is set incorrectly, so possibly take it to the people who set up the CPAP machine and just double check the pressure, make sure it is set correctly for you. Now, other people will complain, instead of having problems exhaling, the pressure feels like the pressure's too much, they may have a problem with feeling like it's not enough pressure, and they're not feeling like when they breathe in they're getting enough pressure. So when that's happening, you're saying to me, you know, I just feel like I can't breathe in. Well, then I would think that possibly the machine pressure could be increased. Of course, that is a doctor's decision to do that, but sometimes a little higher pressure is exactly what the patient needs. So the pressure that is set and prescribed by the physician has to be set by the provider of the CPAP machine. talk to your doctor if you feel like you're not getting enough air in whenever you're using your CPAP, so that possibly the prescription can be changed. So either if you're not having enough pressure come in or not enough pressure going out, there can be some tweaks that can be done on the machine to make that feel better and more comfortable. But as far as the pressure itself, it has to be there, because that is what we need. It's like an internal air splint holding your airway open, and we need to have that pressure. Now, what's real interesting is that when people are brand new on CPAP, and let's say at the time that they're getting set up for their CPAP, almost everyone's eyes get a little big when the machine comes on. It's like, whoa, what's going on here? But over time, like everything else in life, you get a little more used to it, So I would recommend for anyone who has kind of this acclimation problem of just sort of getting used to the CPAP, try this. Go to your home, and well before it's time to go to bed, go ahead and set your CPAP, plug it in, maybe near your recliner, your sofa, and plug it in, put the mask on, watch some TV while you're awake, while you have no intentions of falling asleep, but just watch a little TV with that mask going, or reading a book, or just be awake with it on is the point, and use the CPAP while you're awake for a while, and you'll find that over time it just gets to be more and more easily tolerated. So I would say definitely do that, and that's going to make a big difference. Maybe a little bit each night before you go to bed, or just get it to the point to where when it's time to go to bed and you're putting the CPAP mask on, that's not the very first time of that day that you've experienced the way that this air pressure feels. So I don't want to scare you if you've never had CPAP. It's not really that much pressure. It's just something that is very different from normal, regular sleep without CPAP. So now, what I will say is the number one most important thing and the most difficult thing, the biggest problem that people have whenever they are new to using CPAP, is to remain consistent. You've gone so many years with this sleep apnea that you use CPAP for 1-2 nights, and you have some problems. The mask is leaking, it's making a noise, it's making your mouth dry, or different problems that you're having. And so you say, well, look, I'm just not going to use this CPAP. I'm going to get sleep, but it's really not the right kind of sleep, as the sleep study has already proven. But it's easy to skip a night, and when we skip a night, then we skip 2 nights, and then we skip 2 nights every week, and then we skip 4 nights every week and every month, and we skip a month, and you know how it is in life. Once you sort of let go of that consistency, it becomes easier and easier to let go of the consistency and actually not do it. So I see too many people who really need to be using CPAP who are not using CPAP because of some of the difficulties. So I would encourage you, your physician and your provider, I promise you they want to help you to be able to use your CPAP. So please contact them if you are having problems with your CPAP, so that those problems can be tweaked and worked out, and hopefully to the point that you'll be able to remain consistent. Now, when I say consistent, at least start the night off using your CPAP. And if you don't make it all night, that is gonna be okay. At least you started the night off. And I'm a big believer in, if you start the night off using your CPAP every single night, then what's going to happen is you're going to get more and more acclimated to it. It's going to become more and more of a new good habit that you're actually doing every single night. So if you don't get through the night, that's fine. At least start the night off every single night using CPAP, and before you know it, you'll be using CPAP all night, every night. Everyone will be happy. Your spouse will be happy. You will be happy. You'll be sleeping better. You should have more energy. A lot of people have headaches and high blood pressure and all kinds of problems related to not sleeping well. So I hope that these 3 things, the kind of little tips that I'm giving you here, are things that you can really use to help you use your CPAP. I really want to see you do well with the CPAP, and by all means, please comment here if there's any questions that you have for me. I would love to try to answer the questions, and just let me know where you're watching this video from, and of course subscribe to the channel if you'd like to hear more information about CPAP and other home medical equipment. Chris from AffinityHM.com. Hope you have a great night. Bye-bye.